Thank you, Scott.
Thank you for coming back as well. Also joining us here in the studio, Tammy Cagle is here. She is the hospital's most recent hire in that she is a licensed clinical social worker at San Juan Regional Medical Center. And good morning to you.
Good morning.
Thank you for coming in as well. Good to have you here.
Thank you.
You bet. Thanks for coming in. Reverend Stetter, let me talk to you and begin talking with you a little bit about this whole idea. We've talked previously about spiritual care at the hospital, and now as Tammy Cagle comes on board, now there is kind of some mental health and other types of care as well being offered, correct?
Correct. Yes, I want to highlight our behavioral health unit, our inpatient behavioral health unit. That's
Right.
where Tammy works, and they see patients who meet certain criteria in certain age groups. It's a wonderful resource for our community. And we also have an excellent outpatient behavioral health center. So for a community our size, we have some very good resources for mental health.
Very good. Well, Tammy Cagle, let me turn to you and ask you a little bit about that type of work and exactly what that means for patients and maybe their families and people who find themselves needing to go to the hospital for care.
Okay. So the behavioral health unit where I'm located, we serve folks from the community and from outside the community, ages 18 and above. We provide mental health, behavioral health services, which include medication, groups, and individual therapy and psychotherapy as well. We also provide casework, which includes outreach into the communities. So if somebody comes to us and they receive services, usually between the average stay is between 5 and 7 days, and what we do is we stabilize. So if somebody is in crisis, they come through the emergency room and they meet a certain criteria and they come up and they usually stay from 5 to 7 days. And during that time, they receive services such as behavioral health groups, also casework, which means that we provide and help them find housing, food, family outreach, and things like that.
Understood. And Reverend Stetter, I know this is all part of the overall kind of envelope of care, if you will. There's probably a better term for that at San Juan Regional Medical Center from just what we think about as maybe medical care, but as Tammy Cagle is talking about behavioral health, mental health, things like that, spiritual health, as you're here to talk about a little bit about too, but it's this whole real overarching view and treatment for the patient.
Correct. At San Juan Regional, we are a community hospital, and we're very concerned about the whole person well-being of everybody in the community. So we call it whole person care, their body, their mind, their spirit.
Right. And that really can make a big difference, I would think, in the treatment plan, in the recovery plan of a patient who's coming in. As we were mentioning, if somebody's having an episode and they need some kind of mental health, behavioral health assistance, maybe they've also had some kind of physical injury, and so again, the doctors and nurses and other staff at the hospital can help with that. But it's really usually when someone comes into the hospital, maybe there's more than just one thing going on, I guess is what I'm trying to say. Is that kind of what you see in most cases?
Yeah, absolutely. As a matter of fact, right now we're seeing a really big an uptick of meth-driven psychosis. So we've seen quite a bit of that, and so we stabilize and then offer substance use behavioral health treatment. And so that's been a real big concern. Alcohol and meth are the two main substances that we see in this area and that have affected families the most.
Right. And that leads us to another topic, which is kind of the substance abuse problem that is really devastating not just San Juan County, not just New Mexico, but the entire country as a whole. And of course, the pandemic hasn't helped. In many cases, it has hurt because it has really caused a lot of folks additional stresses and things along that line. And so are you seeing some of that as well?
Absolutely. And as a matter of fact, personally, a member of my extended family overdosed on Monday and passed away, very young man.
So sorry.
The numbers of overdose, the CDC is predicting this year alone 100,000 people in the United States overdosed and died this year. And that is mainly due to fentanyl. The year before that was 90,000. The year before that, 70. We're used to seeing around 50,000 in the United States with overdose deaths. So really, coupled with the pandemic and COVID, I think our tables are going to look very different this holiday season. I know mine will. And so I think we have to be aware and really focus on the holistic care of each family, I think.
Right. And when that happens, I guess, again, there's a lot of other things that are impacted, I guess, by that empty seat at the table or two empty seats at the table or whatever the case may be. And that's got to be difficult for families and individuals to deal with. And is that something that you're seeing too, Reverend Setter, at the hospital or through your work?
It absolutely is. We are seeing multiple family members in the hospital at the same time in some occasions, or a sequence of family members who come in very, very ill, can't improve, and pass away. And that is just creating what I call the old Dagwood sandwich, a very
right, not in a good way.
No, not in a good way.
Yeah.
A multi-layered situation of grief upon grief, and you add perhaps drug and alcohol issues or any substance abuse issues to that. That's another layer. And of course, we know that the holidays are going to be difficult because of the supply chain. We can't get some things. Families don't have as much money maybe as they did last year with the influence of inflation. And and if you have older or other immunocompromised members of your family who aren't going to be able to participate, then that whole social isolation thing comes in, which has been so damaging during the pandemic. And it's also a challenge sometimes as we want to come back out and reintegrate. Some of us have been isolated for so long that we need to do that in baby steps. It's not easy just to come back and launch into a full-scale family gathering,
right?
For
and
some people,
indeed, and maybe some of us saw that at maybe Thanksgiving was maybe the first gathering in quite a while for families, and here comes Christmas right after, or New Year's, or whatever the case, and maybe folks saying, Thanksgiving, I didn't feel very comfortable, and I don't know if I want to do Christmas, and should I feel bad about that? I don't want to be with my family, even though I love my family and I want to be with my family, but there's something else in me that's just saying maybe now's not the right time, or this isn't the right year to do that with COVID raging, especially here in San Juan County.
Yes, that is an issue. I think people have many mixed emotions. They're so happy that some things are open and they have the possibility of being with each other safely, because last year things were still shut down by and large. But at the same time, the fear is there that something may go wrong or they're not quite ready, and the piles of grief are there for many families. So how do you navigate all of those very heavy emotions at one time? And you're right. What we need to understand is that all of those emotions are okay. We are all having those emotions to a degree. Nobody's exempt. And so they're all normally to be expected. And that gives us the opportunity to take some very practical steps for coping during the holidays. For one thing, you can graciously decline an invitation. As long as you do it with kindness and grace, people are going to understand. Or if you need to go somewhere, but you can't stay for hours, this is your first kind of outing for the year, then tell your host or hostess, I'd love to come. I may not be able to stay. Just understand. Make it a graceful situation. So those kinds of things. So we need to honor our feelings and avoid our own perfectionism. If we don't have absolutely every decoration and every piece of food on the table that we normally have, it's okay to give ourselves a pass. And it's really okay for us to be honest and say, last year's pandemic gave me a rest from one or two things I really never liked about the holidays to begin with. So it's okay to let those go and just not to have them, or to start honoring new traditions.
That's very insightful and interesting, and I want to let that kind of sink in to our audiences, because I think a lot of folks maybe are not seeing it from that perspective, and I think that's really important. Tammy Cagle, from what Reverend Stetler was talking about, is that something, again, that those feelings are understandable, they're reasonable, it's okay to feel that way, that you may not want to be around a table of your relatives who you haven't seen in a year, and that's okay, but to let folks know ahead of time and to be gracious about it is probably the way to do that.
Absolutely. I think we definitely need to be mindful as individuals and also validate each other's fears, because they are real. I think the other thing I think is really important is planning. I think that's really essential, especially for people who are early in recovery or in mourning. It is okay to plan out a 15-minute visit with somebody. It is okay to ask family members not to bring alcohol to dinner. I think and also be mindful. I may not be in recovery, but I want to be mindful of others, and help them to be sober. And I think that's really important. It's also okay to, if you're feeling a certain way, somebody else is drinking, is to say, I need to go, and I hope to see you soon. It's also okay.
That's a nice way to say it, isn't it? Than just like, we're out of here. I mean, really, frankly, to say,
right.
Hope to see you again soon, but thank you very much.
I need to go. The other thing, too, I think is really important is you can limit who you're going to see over the holiday and explain to other family members why you need to limit. I think that is okay.
Right.
So that would limiting exposure.
I agree. And for those other family members, I think they need to be gracious as well. If someone you were hoping to see for a weekend says, I'm going to come, but only for an hour, I'll come for dinner, but I can't probably stay, or the family can't stay, the host needs to be gracious as well when they're told that.
Absolutely. I mean, my plan personally is I'm going to FaceTime some folks. I know not everybody has the internet, but for those, it is a great tool. So I may not see you in person, but I will be happy to FaceTime with you. I'm doing that weekend. I'm actually FaceTiming into a party this weekend. Okay, it's a traditional party. I can't be there. They're going to put me on the table. I'm going to be able to see everybody and enjoy time that way. So I think if we get creative, I think that we can still enjoy our family members and spending time with them.
And you're still making an effort.
Absolutely.
To see your family members, which I think means a lot as well. At least I hope they take it as that.
Yes.
And so
absolutely.
That's important. We were talking before we came on the air this morning a little bit too, maybe if folks don't have the ability to FaceTime or internet or things along that line, could this mean the resurgence of the Christmas card list and the Christmas card?
Absolutely. Mail.
Right.
Even in the most isolated villages where I've been, up in Alaska, it took a long time to get that mail, but when we did receive the mail, it was really uplifting. So for people who maybe church members who have lost COVID and you're in an isolated area in New Mexico, you can send out a piece of mail. And I think that would really be helpful for people who are in mourning.
Very good advice. I know a lot of my family and friends expect some kind of letter or card from me every Christmas, and some years it's a Christmas card, some years it's maybe a New Year's card, some years it could be a Groundhog Day card, depending on when I get around to getting it out the door. But I still make the effort, and I think it's appreciated. And again, if you don't have that ability, it's great to reconnect at least at one time of the year,
right?
Which I think is what happens. Reverend Setter, again, for that, when you're able to reach out to somebody and talk to them about how the year has gone and feel how they're doing. I mean, that's a good way to connect with people. If you can do it over even a phone call, I guess would be helpful too, wouldn't it, to connect with someone?
Right, because illness, isolation, the pandemic, social pressures, the economy, the whole ball of wax has a way of disconnecting us from our spirits and also from our resilience, because we all have, I call it a bank account of resilience, and many families have had that tapped so much by tragedy and loss and stress this year that they just need a little time to build that back. And any way you can reach out and give people hope, give them words of encouragement, that's going to help lift their spirits and reconnect with that deep inner part of themselves that says, I'm okay, I'm going to make it through this, other people care, especially for people who might be, there's the expression Blue Christmas. Christmas is not always a time of joy for people, and I think a lot of people are going to be having what we call a Blue Christmas this year, and they're going to need more people to reach out to them, to support them, to honor their feelings through this. And that brings the subject of depression,
right,
which we have to be very watchful for, especially during the winter. So keeping connected with other people, because humans are made to live in community. We're made to be connected with each other. However that can happen will help depression and make it okay for people to know that they're going to make it, that they're encouraged, that somebody loves them, that they're valued, that they have purpose. All of those are extremely important for us to reconnect with our spirit and to keep our spirits healthy.
Very true. And I think that's been one of the more difficult things about the pandemic is that we haven't been able to connect with folks in a way that we're used to. And so after almost 2 years now of being apart and kind of enjoying each other from a distance and those types of things, it's difficult. And maybe folks aren't realizing that that's what's causing them to be a little less cheery and thoughtful about the holidays coming up and things along that line. It could be. That's typical winter blahs turn into holiday stress, turn into a little bit more serious issues for some people, and they may not realize what's happening.
Exactly. It's a slope. I mean, it doesn't just happen overnight. It can happen over time. And for some people, it's serious and it can become chronic. And that's when they need to engage with us at behavioral health. Or if they start having feelings like they're so blue that they would just like to check out or harm themselves or harm somebody else. And it's really important for them to walk into our emergency room because they're going to find a place of compassion and understanding and help there.
Absolutely. I do think if you find yourself isolated this year and you have COVID and you're going to be home alone this holiday, I think there's a couple of things that you could do that will help with depression. And one of those things we are lucky that we're in New Mexico and we get a lot of sun. So 15 minutes outside in the sun will boost you. Making sure that you get in the shower every morning. The other thing too, and I think you did tap on something, is just hearing somebody's voice. That really is just calming sometimes. Somebody is out there. Call a family member. Even texting. Reach out to somebody you haven't talked to or texted in a really long time, because that's going to uplift them as well. So there's just little things that we can do to help ourselves get through these isolation periods. Nutrition is another one. So I think it's just really essential self-care during this time, and for the hospital staff as well.
Very true. And I can't tell you how grateful I have been for the New Mexico sunshine over the last 20 months, because it really does help. And so again, to my East Coast friends, it's tough when they don't see the sun for months at a time. We are so grateful that we live in this beautiful place. You mentioned the employees of Salmon Regional Medical Center, and I want to bring them up as well, because they have been through a lot. And I think that doesn't even encapsulate what I really mean to say, but just a lot, all capital letters. And you are there as well, Tammy Cagle, to help the employees, are you not, to deal with the things that they're dealing with day in and day out. And we have seen in the news the stories of the just overcapacity and the staff that is rising above and going beyond to deal with increased numbers of patients, increased demands, increased needs, and shortages of this and that and the other, and whatever the case may be. But that's another really important part of you being on staff, is it not?
Well, yeah, resilience. Again, we talked about resilience. So with our staff, we're seeing that resilience has really come down quite a bit. One of the reasons is they're working really hard, right? We're really short of staff. And the other thing is not seeing an end to this, right? They're not seeing the light, because, so many people are passing on our COVID floor. So many people unvaccinated coming in and being very sick. And this is really wearing really hard on the staff. One of the things that we did is we created a support group where they can debrief and process with each other. And so that's how this Well, they can go online on the hospital website and actually go in and sign up for there's only for the group.
Mm-hmm. Okay.
It usually runs weekly. Now we're down to 2 weeks this for December, but I think it's really helpful that people get together with their peers outside of the hospital and actually process. And that builds resilience. It builds support. When you build support, you build resilience, and I think morale would also be a little bit higher as well.
Right. Linda Stetter, what about for you? I mean, again, you're available if an employee needs to talk or just get something off their chest or whatever to deal with help deal with what they're dealing with day in, day out?
Absolutely. I round on staff every day on every floor. I get to every floor somehow, and also other departments, because we have amazing housekeepers, we have amazing materials management people. There are people hidden down there who are doing the central sterile processing, the nutrition people. There are amazing people all over that hospital who are diligently doing their work, and not only are they doing their own jobs, but they're volunteering above and beyond to be on what we call our alternative care team, to go up to ICU to help turn patients, to fold the gowns in the laundry, to do whatever needs to be done around the hospital to make it easier on different departments. So yes, I am available to talk to any staff member. I round, and I've set the chapel up for Advent, and I also do some kind of fun little things for them, fun de-stressors like lavender balls for every department for the people who need a little aromatherapy. So absolutely, it takes all of us. We call it the all hands on deck time. And we do it with great joy. To us, it's not a job. It's a calling to care for this community. And we do it to support each other and because we believe in our mission as a hospital, and we get joy out of it.
Right. And I agree with you. But all hands on deck after 18 months, 20 months, that's a lot of hands on a lot of decks, and those hands are probably getting calloused after all this time. And so they need a break or a way to at least kind of take a break or talk about what they're dealing with from time to time.
They do.
And they're doing that.
And some of those are in my office. Some of them are in their office. Some of them are just quiet conversations in a meditation room or at the end of the hall, or even groups and just laughter. You know, I think COVID has squeezed a lot of the joy out of all of us, not just in the hospital, but everywhere. And so the more humor we can bring into things, the more we can make people laugh. You breathe, you get endorphins. It's a fun thing to laugh, and it's a good thing to laugh, even when life is so serious. So I think it's important, and I try to say goofy things to people every day just to make them laugh.
Well, I say goofy things in the morning on this program, and sometimes I mean it, and sometimes I do it unintentionally, but I understand what you're saying. Mm-hmm. And it is important to be able to laugh, I think, even during these very serious times and facing some of these very serious things that we are all been dealing with. So I completely understand what you're saying. We just have a couple of minutes remaining this morning, both of you, and I just want to get your final thoughts for the holidays. Again, we talked a lot of good, important information for folks to understand what's available here at our local hospital and the resources that are available, and just, again, to help us deal with the holiday season. Tammy Cagle, some final words of advice for folks who are listening and watching us this morning?
Well, I think for my population in particular, really healthy boundaries is going to get you through the holidays. You know, feeling comfortable with talking to other family members and even with your own peers about, you know, what your limitations are for the holidays, and reaching out and that's where we're at.
That's a good piece of advice, Reverend Stetter. Same to you. Some final words of advice for everybody who's tuning in this morning?
Well, of course, we all wish everyone an amazingly happy holiday, but a safe holiday. And if something should happen, remember that we're there for you. Come visit us sooner rather than later. We like to say, especially if you test positive for COVID. Normally, we think of colds and the flu as stay home. We've been taught this as conventional wisdom. Stay home, drink a lot of fluids. It'll pass in a few days, take over-the-counter stuff. But it's just the opposite. with COVID, we don't want to give that virus too much of a head start. So our hope for Christmas is if people who test positive can come to us sooner rather than later, especially if they're in high-risk groups or over the age of 65. I am thrilled that we have a monoclonal antibody clinic in our town and that we're able to do so many infusions and help people kind of kick that virus a little bit before it really takes them down. So,
and that's one of the, pardon me for interrupting, but that's one of the treatments that can be very effective if it's taken early.
Right, and you need a referral for it. So your primary care physician or the urgent care clinics or the emergency room are the perfect places to go to say, hi, I'm testing positive for COVID and I'm starting to kind of feel a little yucky, so what's available for me? And they will help you get the treatments that are just right, including our amazing COVID to home program, where you can be at home in certain circumstances, and they monitor you and help you through your cycle of getting wellness. We have a lot of options, and we just want people to be at home, be safe, and have a happy holiday.
Very true. And I must say, if it wasn't for that COVID to home program, the hospital would be even more crowded than it is today. And so we're so grateful for that. And that's been going on for months.
Yes.
And so, again, we are grateful. I am grateful for both of you for coming in this morning to talk with our audiences about the work that you both do at the hospital. And on behalf of all of us, we do appreciate everything that's being done by our community hospital. Thank you very much for being here.
Thank you.
You're very welcome. And Merry Christmas to both of you.
To you as well.
Thank you very much. My guest this morning,